And so today I will take you through the journey, discussing and hopefully really interacting with you through chat room or maybe through discussions about physical exercise therapy for people with type 2 diabetes, particularly addressing people of elderly age. So some practical issues for this event. So please remember to keep your mics muted and cameras off if you would like to switch off cameras, it's okay. If you want to stay online visible, it's okay too. So we're gonna use Menti.com. I hope that you have computers, of course, open or phones available. And I would like you to start this first practice. So if you type in Google Menti.com or whatever browser you use for internet, and when you Google Menti.com, you will be asked to type code in. So you type this code in, and then you will get to the question, who is participating today? So we would like to see how many of you here are students, teachers, or other. And I will share also results. So if you please open Menti.com and type and check answers for the question. We're gonna discuss types of exercise therapy of elderly persons with type 2 diabetes. And so in general, we will discuss what type of exercise modes are most appropriate for elderly persons with type 2 diabetes. Also, we will look at some evidence, which is very important for us as a health professionals to look at the latest evidence because it's changing very rapidly nowadays. And so we'll go through some recent research publications, and I will present some review and also randomized controlled trial outcomes which have used interventions applying different modes of physical exercise for type 2 diabetes persons. Also, we'll discuss how technologies might be used for elderly people with type 2 diabetes, because nowadays technology is making a big progress and becoming users friendly, also including people of elderly age, but maybe it's different from country to country. So I will present a recent study we did in Latvia about that. Also, we'll just go through some behavior change theories and models, because in order to achieve goals in daily physical activities, it's important to teach participants which we are working with how to change their behavior and how to maintain those habits of active lifestyle for long term, not just for the time being while they are in a study research or they are in a therapy program, but also afterwards when they discharge from rehabilitation program. Of course, you're welcome to drink coffee or tea or whatever helps you to stay awake and alert for a whole day, because it's going to be a long day for you and for us as well. So yeah, and again, as I said, if you are willing to ask questions, you are welcome to type in a chat, or you are welcome just to switch on your mic and ask questions directly. So yeah, let's go quickly through this first picture. So what do you think? Which answer is correct? And you are welcome to type in a chat room. So this man checks the watch while walking to meet his friend. So it's a number 1. This man looks in the map on his phone. It's an answer number 2. This man does individualized daily physical activity program. It's a answer number 3. Or number 4, this man tries to remember the items on his shopping list. So you're welcome to type in the chat room which answer you believe is the most relevant for this picture. Number 1, number 2, number 3, or number 4. Okay, great. I see many 3s are coming. Number 3, yeah, you are correct. So this man really does individualized daily physical activity program, and phone in his hand is giving him a correct exercise intensity mode. And actually what you don't see, he also has a pulsometer, heart rate monitor around his chest, which is connected with the phone application. And so according to his heart rate, phone gives him a message whether he needs to walk more faster or he needs to slow down and go slower. And he particularly does interval walking training. And so he needs to address his individual therapy goals regarding his daily walking distance. So I will talk more about this research because that was done in Latvia, in Riga, 2 years ago. And we were very successful with producing application in Latvian and Russian language for our participants. So, yeah, great. Thank you for great answers. So again, since you are already a Menti-Com, let's check what is physical activity mode for each of you. So are you doing physical activities at least 150 minutes per week? So it can be walking, running, going using stairs, or just maybe walking on the street when you have to go to bus station or metro station or to your work office, or you're using public transportation and not walking at all. So let's see what are answers for you in this question. And you're welcome to type this question answers in Menti-Com using code which is indicated in this slide. People who are elderly now, but we already have to work with children, with adolescents who are spending more than 5-6 hours per day in general by screens, and how to change their lifestyle so they would keep those active lifestyles also after they get adults and they become elderly people. So that's why it's very important not just to focus on elderly people, but also work with the whole population, all society, to change behavior, habits, and be more aware about health issues might come with the age. So here in Ukraine, some statistics, probably you are more familiar than me about those statistics, but if we look at the statistics related to type 2 diabetes, so we see not only type 2, but with diabetes in general. So we see that this line is increasing, and it's not surprising. It's increasing in all countries. And females in average in all countries are more like tended to have diabetes, but it's not only because like females are females, but because females in general have longer life expectancy, and basically, yeah, there are more females of elderly age than males, and that makes this proportion larger. Overweight, obesity, again, for females, it's much larger. But when we look at physical inactivity, again, it's more for females, but in general, if you look at the physical activity programs, you will see more females being active and more females involved in physical activity programs. And that was also in our research we did in Latvia, where actually 75% of participants were females. Okay, so yeah, about type 2 diabetes, it's a very large group of population, and of course individualized physical exercise programs are very challenging to provide each individual. That's why we should take into account like group exercise, and not only like a control situation, but also how we can provide free living exercise programs for these people. And those people are very frequently visiting family doctors, physicians, physiotherapists, and especially for elderly people, health literacy, how much they understand what is provided by guidelines, by doctors' kind of suggestions, what is written on, for example, medication explanation. So it's a big issue that most of elderly people actually partially understand what doctors said. And in a study where they were asking elderly people, did they understood what doctors said, only 15% said yes. So basically taking into account that there is limited time we can spend with each individual during therapy session or during a medical appointment, it's very challenging to make it very clear and understandable for many elderly people what is exactly they have to do to help to be more active. And most of them understand, okay, I have to be more active, but how to do and what to do, it's still not clear. And what kind of additional kind of feelings might be while doing physical activities, for example, muscle pain or some they might get tired and then they stop doing physical activities, not because they don't want to do physical activities, but because they are getting afraid that there is something wrong and they don't know what's going to happen next. So that's very important to educate also people we are working with what might happen when you start doing physical activities after a long time being sedentary. So about type of diabetes, I will not spend a lot of time on this screen, but I think most of you know about those like general 3 types of most common type of diabetes, like type 1, type 2. So we today talk more about, of course, type 2 diabetes. And what is very important also to address people with prediabetes, because from those who have prediabetes, actually, according statistics, about 25% of those people within 3 to 5 years are having diabetes. They are diagnosed with diabetes. And about 70% of them actually develop diabetes in a lifetime. So that's why we cannot, and people shouldn't ignore signs of prediabetes as well. So what happens in a diabetes? Basically, beta cells, which are producing insulin to facilitate glucose uptake into glucose recipient organs, mainly the muscle, brain, liver, and adipose tissues. So they basically are not producing enough insulin, and that's why glucose level is increasing. And obesity is a key risk factor for type 2 diabetes, and is since as it is desensitized glucose recipient organs to the action of insulin. So yeah, again, of course, physical activity and diet would be a nice combination if we apply physical activity program for people with type 2 diabetes. So yeah, let's try this one. I'm not sure, I hope it's gonna work. So let's go to Menticom again, and you just type what are risk factors for type 2 diabetes besides those I mentioned. So if you could go back to Menticom, and while I'm continuing speaking, so you again type what are your ideas, what is reason for what are main risk factors of type 2 diabetes. Risk factors I can already present, but you can indicate others. And I see some answers are coming, which are also overlapping with answers I have on my slide. Overweight, obesity, risk factor, yes, and more than 75% of people have obesity, overweight, increasing age. So first degree relative, yes, and you also have mentioned family history. Yes, I will share in a minute your answers. Age and ethnicity, and according to international studies, from 17.7% in white European individuals to 22.5% in Asians, while you see that most of prevalence of type 2 diabetes are in American Indians, also, Alaska natives, particularly in adults over 75 years of age. And what is important to note that mortality associated with diabetes has increased over past 2 decades, and not just because of diabetes, but because of those secondary health issues like stroke, cardiovascular disease. And that's why International Diabetes Federation recommends screening for frailty in all diabetic individuals over 70 years of age. So those people particularly should be under lens of doctors. So here you see your answers. Yeah, so the same, like obesity number 1. Yes, that's what you typed like most frequently. Family history, overweight, yes, genetics. Of course, yeah, it might be related to family history. Yeah, great. I see you know a lot about risk factors of diabetes, so I will not stay on this slide longer. So if we go next about relationship between, or what is the relation between type 2 diabetes, cardiovascular disease? So there is a high correlation between those two, and people with diabetes have up to 5-fold increased risk of cardiovascular disease, and about more than 65% of people with diabetes actually die from heart disease and stroke. Also hypertension in 60% of patients with type 2 diabetes. So again, we cannot see type 2 diabetes just as a diabetical issue, but also cardiovascular problem, and that's why physical activity is particularly important for daily living of these people to keep their quality of life. Other complications like microvascular complications, retinopathy, you know that some people with in a lifetime they get blind, and also peripheral neuropathy, which might cause amputation of lower leg, nephropathy, foot ulcers, others. So a common link, which is also indicated in the research, that better the blood glucose control, the lower the risks of complications. So how we can control the glucose? Yeah, only one recipe, like without any costs, it's a physical activity. So you are probably familiar with those charts, and particularly those who have relatives over 50 years of age, even 40 years of age. And those charts are produced by World Health Organizations. You can find them online. There's a link. So just see what is a risk factor for especially men and who are smokers. And particularly, they are distinguishing between non-smokers and smokers. Those who have hypertension, like there is a blood pressure levels, and they are smokers, so there are higher risks also for cardiovascular disease. And in addition, if they have type 2 diabetes, which is quite typical after 40 years of age, so those risks are even higher. So just check out those websites I'm indicating in my slides, so you can easily screen your patients when you meet with someone who is having some issues with body weight and stressful lifestyle, and with addition with smoking. So there are quite large risks also for type 2 diabetes and cardiovascular risks. So here was one study done quite some time ago in 2002, but it's very kind of important, and probably that some other studies have been later, but in particular in these studies, they were looking at pre-diabetic persons and about development of diabetes during their life. And as you see, with a combination of lifestyle, improving lifestyle, being more active, so that reduced incidence of diabetes significantly. So you see this lower line indicating how slowly diabetes became as a part of health issue for those persons who changed lifestyle. While there was medications used, this is a middle line, and those who were not using anything like placebo, just recommended to change a lifestyle, so they actually more often and had a higher prevalence of developing diabetes during their lifestyle. So again, those long-term studies are helping us to understand how diabetes might be developing during many years when person is controlling or not controlling his daily lifestyle. So, okay, most important part of this session, what is physiotherapy and how we can address as physiotherapists management, health management of people with type 2 diabetes of elderly age. So there is no particularly physiotherapeutical methods to apply for type 2 diabetes, but most frequently, and this is also indicated in Physiopedia under diabetes section, that exercise therapy is only appropriate physiotherapy management to apply for people with type 2 diabetes. So we basically will discuss exercise modes and different exercise intensity and types indicated in the research. So most frequently and the most appropriate exercise therapy modes are aerobic and strength exercise, and those in the latest research evidence are mentioned both together, not just aerobic, but both with strength exercise and combined with each other. And both exercises are reassuring positive adaptation in the control of blood glucose concentration, insulin action, muscle strength, exercise tolerance. And also there are evidence on different modes of exercise, like which are increasing uptake of glucose by muscles, improve utilization, and altering lipid levels. Basically, regular physical activity is beneficial for people with diabetes, in addition to all the benefits noted before. And we have to understand that already 2 sessions of physical activity are giving beneficial outcomes, lowering glucose levels after exercise, and also in the result improving insulin sensitivity by doing exercises regularly. So basically better glucose control can lead to a reduction in diabetes and therapy, and will reduce the risks of diabetic complications in the long term. Okay. So disability by preventing and treating and rehabilitating neuromuscular complications like neuropathy, skin breakdown, foot ulcers, arthritis, and others, those secondary risk issues might be avoided if regular physical activities are applied. So guidelines for safe exercise programs, yeah, it might differ from each individual, but in general, guidelines says that do not exercise if the blood glucose level is less than 5.6 millimoles per liter. That's what usually are used in a measurement by glycometers. So in Latvia, particularly in Europe, I think we use those millimole on liter measurement, or greater than 14 millimole on liter. However, in my experience, we had also patients which came with a 16 millimole on liter, like patients with type 2 diabetes, and they were quite okay to do light physical activity exercise. So that's why in type 2 diabetes, it's important to address each individual and see how they feel when they are doing physical activities. So of course, hypoglycemia or hyperglycemia are two issues which should be addressed immediately. And also eating in relation to physical activity modes, also glucose levels, especially in those days when they are doing physical activities, they should particularly check glucose levels. Of course, water, at least 2 liters per day, which is suggested by endocrinology doctors that every person actually should drink a lot of water, but particularly people with type 2 diabetes, they should drink water as well. So stress-free exercise, for example, people come for exercise first time and they already have stress, which increases their glucose level. So again, we should have really kind of relaxing and free of stress exercise environment so that people are not getting like overstressed during exercise. Also avoiding late night exercise programs. And of course, regular physical activity is very important, that no more than 2 days between exercise. So basically follow guidelines regarding diet in combination with the safe exercise programs are beneficial for people with type 2 diabetes. Okay, so let's move more to kind of evidence-based research examples. So benefits of physical activity, as I mentioned, exercise alone decreased by 0.66%, while diet plus exercise, as you can see, it decreased even more and improves health condition in persons with type 2 diabetes. So basically, when sugar enters our blood system, it attaches to hemoglobin and protein in your red blood cells. So, and it's very important that everybody has some, like, of course, attached sugar to their hemoglobin, but people with a higher blood sugar levels have more. So, which is not good for in general health situation, and simply we have to reduce by exercise and by diet blood glucose level, which is very effective while doing exercises. So benefits of physical activity, particularly regarding type or intensity of physical activity, moderate to high volumes of aerobic physical activities are used most frequently, and they are appropriate for both like type 1 and type 2 diabetes. While in type 1 diabetes, aerobic training also increase cardiorespiratory fitness, decrease insulin resistance, improves lipid levels, and also endothelial function. While in type 2 diabetes, particularly regular frequent training modes reduces the glucose level and triglycerides, blood pressure, insulin resistance. So these are general benefits. And again, what I mentioned before, just to remind that those three exercise types are most frequently and most commonly used for elderly people with type 2 diabetes, like aerobic exercise, resistance training, and balance exercise, especially because people at the elder age are in risk of falls. And that's why balance exercise are also in combination with resistance and aerobic exercises are very beneficial. And so walking is the best medicine for diabetes. That was already written in 2003. And in a cohort study, including 2,896 participants, which was quite large study, including both type 1 and type 2 diabetes. So people who walk at least 2 hours a week at self-selected like tempo, not even like secured by monitoring heart rate. So basically they were just walking at least 2 hours per week. They already lowered risk of cardiovascular mortality and lower risk of cause mortality. So it means that like doing something, it's already benefiting their health rather than not doing anything. So from that point of view, of course, the long-term benefits are coming slower if people are doing self-selected physical activities, but they have to do, of course, physical activities. But if those physical activities are controlled and individually assigned, so it's even better. And I will show some evidence in a minute. So benefits of other types of physical exercise, what I mentioned before, balance training, yes, group exercise, of course, interactions. It's very important that those people can share their experience, they can share their feelings and self feelings while doing physical activity. So it's important for some people to do physical activity together with others, especially at the elder age when they are having less social life active. Yoga, Tai Chi, which has been also widely used for people with type 2 diabetes. So that was already, and there's some, in my slides, you can see some evidence with research about those type of exercise. So if you're interested, you can check out those references afterwards. So again, regarding physical activity programs, it's very important that we indicate in this program type of activity, frequency of exercise, intensity, and duration. So basically, to improve literacy, physical activity literacy of people of elderly age, we have to give them a recipe indicating all those 4 parameters. So the person, after discharging from rehabilitation or after end of our physiotherapy session, he knows what type of physical activity he or she has to do, at what frequency, what intensity, according heart rate, for example, because all people know how to measure heart rate, or even we can use smart watches, like just simple like watch, which gives feedback, or phone application, which gives feedback about the heart rate. And people, of course, like I mentioned in my previous slides, have to do at least 3 times per week, no more than 2 consecutive days between training sessions. That's also important message we have to teach our clients about physical activity modes. And of course, mentioning that the physical activity actually doesn't cost. You don't have to go to expensive gyms and buy Nike sportwear in order to start doing physical activities. You can just go outside and walk in the park, do some activities at home, and use different equipment you can find at home. And also I will present some examples we have presented to our elderly people with type 2 diabetes. Okay, so yes, and now I will just go, and my next slides will present a particular type of exercise and how it benefited health of people with type 2 diabetes. So aerobic training increases mitochondrial density, insulin sensitivity, and so on. Moderate to high volumes of aerobic activity are associated with substantially lower cardiovascular and overall mortality risks. So we already covered that. And resistance, yeah, exercise benefits also, we already covered that. So just mentioning that if combining resistance and aerobic exercise, it is more beneficial performing resistance exercise first, and it results in less hypoglycemia than when aerobic exercise is performed first. So basically when aerobic and resistance training is combined, so make sure that your clients, participants are doing resistance training first, and afterwards they do aerobic exercise. So benefits of other types of physical activity. Here also some simple presentations, and I have shared with you some physical activity cards which were produced in one of our projects we did some years ago together with many European countries, and we produced physical activity cards for elderly people, and those are really easy exercises each person can apply, and it's really nicely presented. So just we'll just show you some examples. Yes, active aging, and you have a link to those cards. And also you see there are like 20, oops, this is not, I don't know why this, let's see, we don't need this advertisement, which comes, okay. And no, we don't need that, just take it away. Basically, yeah, in this physical activity card, you have 24 cards indicating different modes of physical activities, and easily applied for elderly people. Also, when we have chance to meet, I will be happy to share and provide my colleagues with a video, and I will just show you a video of one. Just quickly try to get rid of this online. Okay. So, and this video is including 3 types of activity examples. One is for people of elderly age in water. One is for people of elderly age in free living exercise, like outside. So you can see Tanapa 2, and actually those activities, also videos, are available online. I hope you can hear also sound. Just let me know if you don't. Just type me in chat, but I can just quickly show you 2 minutes introduction for one of those video.
We don't hear the sound. I think
there is no sound. Yes.
No sound.
Oh, okay. Thank you. I will just put the sound on. Yes. Thank you.
Part of your life. Exercising at my age, isn't it dangerous? Why should I do sports? These are possible questions that can pop up in your mind. Well, let me try to convince you that living an active lifestyle will improve the quality of your life. There are many benefits of physical activity for older adults. The most important are improved health and physical ability. For example, being more flexible will help you reach a cup on the top shelf or tie your shoelaces. Being stronger and having better balance will help you lift and carry sacks of groceries. and will make it easier to stand up from your bed, chair, or get out of the bathtub. Improving your cardiorespiratory endurance, your heart and lungs, will enable you to climb stairs, dance, or play with your grandchildren without getting out of breath. Furthermore, regular physical activity reduces the risks of developing medical conditions such as osteoporosis, diabetes, cardiovascular diseases, and can reduce the risk of falls. People who exercise are less likely to become depressed.
I will give video CDs when we meet with my colleagues, since we produced very many those CDs and they are available, so you can probably also translate maybe subtitles for those video. And also here are some examples of video of actually small activity cards we produced for elderly people my students were working with in a senior center. And really those are very simple activities which are just giving idea to elderly people that physical activities are not something very difficult or very challenging, but it's really easy, like to hold a leg up like 2-3 seconds in order to improve their body balance, and also a little bit strengthen their muscles. And it's sometimes, yeah, it looks very easy, but for those people who spend in sedentary lifestyle 8-9 hours per day, and that's a reality, and especially in social care centers, they spend about 9-8 hours sedentary. So it's a bit challenging, also such easy exercise. So I will not spend much time on assessment methods, which are mainly used in research studies for elderly people, but just mentioning some assessments we are using in Latvia for physiotherapists to assess activities of daily living. So I don't know if you are using those assessment methods like Bartel Index, Rivermed Mobility Index, but these are kind of most frequently used assessment methods by our physiotherapists for elderly people, and you can also see links to those methods. Also, 6 minutes walking test, which will be in the next presentation by my colleague Kwok. So there just one simple evidence example, again, just understanding how much persons with type 2 diabetes might manage to walk during 6 minutes. So an average in this research, which was done in 2018, so mean travel distance was 538 meters. So not much, but this is a kind of what I mentioned, stress-free assessment, the mode which we can use instead of VO2 max or VO2 peak. And of course, this is predictive calculation of VO2 peak, but for elderly people to use face masks in order to assess their VO2 peak in a laboratory setting, it's really stressful, and it's challenging to get real outcomes of those tests in a laboratory setting. So that's why 6 minutes walking test is more kind of appropriate. So again, so next part of my presentation will be about the evidence. So live study, which was done some years ago, but presented in a JAMA journal. So they screened a large number of participants, not only with type 2 diabetes, but elderly people. And as you see from all those participants which were in the study, 818, almost 25%, like every 4 participants had diabetes. And so in this study, they were assessing their quality of life, also medical history, physical examination, physical activity. Again, there is a guide which you might use. It's a short physical performance battery, very easy to apply. And there is also guide video presentation how to use this short physical performance battery. So I will not spend time for that, since this is a link you can use later. They used also 400 meters walk test. They applied actigraph accelerometer to measure their daily physical activity for 7 days. So at the end, they also had a randomization of those people who were eligible for this study, including 818 people in physical activity group, and in a health education group, 817 people. So basically what they did in intervention group, they asked people, elderly people, 30 minutes walking daily at a moderate intensity. So basically moderate intensity, they were not providing any like phone applications or which might help them, but basically it was more like self-selected moderate intensity mode according Borg scale. And Borg scale, which is used widely just to let people understand their intensity level. So basically they were asked to walk at intensity 13 out of 820. So it was somewhat hard. So for some people, maybe it's just walking a very slow tempo. It's somewhat hard if they haven't walked at all. And they use 10 minutes of lower extremity strength exercise, balance training, 10 minutes. So basically those physical activity programs were very simple, including simple activities which could help people get more active during the day. And intervention started with lighter intensity, and it's very important that we are not pushing those people start immediately like walking 1 hour per day if they haven't walked at all for last 6 months. Maybe they used just to walk outside for 5 minutes, 10 minutes. So that's important that those physical activities are increased gradually. And what were outcomes? So basically, education group was attending education program, and they were continuing habitual lifestyles. They, of course, were recommended to be more active with it, but they were not given particular physical activity program. And as you see in a physical activity group, so they maintained average 250 minutes per week. So they were exceeding actually those 150 recommended, while in a baseline, they had 138 minutes. And then intervention group also maintained 104-minute difference compared to health group. So attended weekly, which attended weekly and monthly sessions. So and physical activity group for accelerometry measures for 7 days. So they presented the 213 minutes active time average change from baseline, 15 minutes of moderate intensity. So basically, physical activity intervention compared with a health education intervention significantly reduced major mobility disability, which is very important for elderly people, persistent mobility disability, and combined outcomes of major mobility disability or death. And so that study was done for 2.6 years. So it was long-term study. So, and our conclusions that the structured moderate intensity physical activity program had better outcomes, reduced mobility, like disability issues and risks of disability. So again, they're just presenting simple physical activity. So what else have been lately coming in terminology of healthcare professionals for people of elderly age, not only elderly, but just people with any health conditions? It's a sports science terminology. For example, high intensity intermittent training versus moderate intensity. How high intensity, again, it gives us message that it's something very like exhausting, and people are really running out of breath, and it's not appropriate for elderly people. However, more and more research evidence presents outcomes. So after implementation of high intensity, for example, interval training, walking. And in general, those high intensity interval walking training has benefited rapid enhancement of skeletal muscle, oxidative capacity, insulin sensitivity, and glycemic control. So it can be also performed by persons with type 1 diabetes. So so high intensity intermittent training, so it improves glucose stability, impacts also ectopic fat. So ectopic fat is also associated with insulin resistance and type 2 diabetes. And also it plays important role in glucose homeostasis. And what is impact of high intensity intermittent training on cardiac structure and function? Because remember that cardiovascular disease is a very important, significant risk factor. So would those training modes improve cardiac structure function alongside with improving glycemic control and reduce ectopic fat? So we'll see some examples. Yeah, this is just to present this ectopic fat deposition and how it works in our body, and basically what we want to get rid of those fat which we should be used for energy use, not maintaining in our body, and give person more kind of adiposity risks. So as in this study, in a research study where they use intervention with 36 cycle ergometry sessions over 12 weeks, again 3 sessions per week on non-consecutive days. And in this high intensity interval training, they use 3-minute recovery periods combined with each high intensity interval training interval, which consisted of 90 seconds passive recovery, 60 seconds of band resisted upper body exercise, and 30 seconds to prepare for the next subsequent interval. So basically 3 minutes are done in a like high intensity, and then there is a recovery period of time. Of course, which is not like copy paste the same what we use for high level athletes. So that we have to, of course, monitor the heart rate of persons. So we are involving in a research. So in this group, as you can see, the average age in our experimental group was 61 year. Body mass index, as you can see, it's obesity, like over 30, and also glucose levels are high, fasting glucose levels, VO2 peak, it's a kind of low, like moderate, 21, 20, it's quite low physical fitness level. And so what were outcomes for this interval training intervention? So yeah, this high intensity interval training increased left ventricle wall mass. So basically it improved cardiovascular parameters, also increased end-diastolic blood volume, and also significantly improved systolic function indicated by rise stroke volume. So those cardiovascular parameters increased in a high intensity training group, in experimental group, and you can see also here in significant results indicated. So however, this 12-week intervention didn't change body mass. So actually, according to other research, it mentions that in order to change body mass, you need more time. So you need at least 4 up to 6 months to reduce the body mass, but it reduced a visceral adipose tissue. So that was also a positive outcome of this study. So yeah, high intensity interval training can improve cardiovascular health parameters. Also, there were a significant change in relative reduction in liver fat, which is very important for type 2 diabetes to change, to reduce that. Also changes in ALT and AST, also change in liver, that fat correlated with change in fasting glucose, and also outcomes in glycemic control. So between group comparisons, improvements were in a glucose control, particularly for intervention group, as you can see here. And also here, there was a significant improvement. So no impact was on fasting glucose, also no impact on fasting insulin, and no improvement in insulin sensitivity. And again, other research indicates that 12 weeks, which is about 3 months, is not enough. So another research, it's indicated that you need at least 4 up to 6 months to change glycemic control parameters. Okay, yeah, so regarding high intensity parameters, so what we can learn from some research done before, it's very important to have a high adherence rate. So the participants really have to be involved in a research study or in their programs at a high participation rate. So it's doesn't work if people are quitting after first month or after first week. So that's really like important what we have to teach our participants. Also, gradual increase of intensity. For example, here this active intensive mode was for 30 seconds and increasing up to 58 seconds. So of course, it's also important that we don't start with a high intensity for long term. So we just adjust the high intensity time to level of fitness level of each individual. Again, here, like intensity increase from 2 minutes, 85%, up to 3 minutes with a moderate low intensity 2 minutes. And here also from 30 seconds, 83%, up to 4 minutes. So it's quite large change in intensity from 30 seconds up to 4 minutes. And so, yeah, it depends of participants. And of course, each individual is unique. That's what we have to kind of keep in mind. For example, in our study, which was we'll skip, since we are running out of time, we'll skip another Menticom slide. But yeah, if person does physical activity in combination with diet control, so it gives even better results. So at the end of my presentation, I will just present our study we did some years ago, and this is one of our publications about interval walking training, which was managed through smart mobile device. And so we particularly were looking at outcomes related to physical fitness and also related to albuminuria and leptin adiponectic ratio in patients with type 2 diabetes. So as you can see, we had a large group of researchers, including endocrinology, IT professionals, and physiotherapists working together. Of course, teamwork also is very important. So we had Latvian mobile company, Latvia telephone company providing phones for our participants, because not all elderly people in Latvia have phones which can upload, for example, physical fitness applications. That was our like a very big success to have those phones. But so what was kind of idea behind this project? To see whether people with disability, with type 2 diabetes, are capable to maintain participation in in 4 months long physical activity program, because as I mentioned in my early stage of presentation, it takes a lot of self control and discipline to change lifestyle, which they haven't been doing maybe for decades, and suddenly you have to be active like 3 times per week and 1 hour. So when we call for participants, so we had 81% answering and kind of applying for this research, and after first screening there were 78%, and then 64% came for randomization. So as you see, our groups were quite small comparing to those groups I indicated before in my presentations, but we were happy to have these people because they were telling that, yes, I want to change my lifestyle, I want to be more active, and I want to help myself to improve. And those people didn't have insulin, so they were not insulin dependent. So they used just medication to keep their glucose level under control and insulin level. So as I mentioned before, so we have females and male, females more than males in our interval training group, 24 and 26 in total in control group. So according age, you see in control groups, there were a little bit older people than in interval training, but we did randomization according VO2 peak. So what we provided our participants, mobile phone application, which was indicated by color and by voice message, and also by written message if they have to do faster walking. Basically, our ideal training mode was like this, that people are walking 3 minutes slow, 3 minutes fast, 3 minutes slow, 3 minutes fast. And for 1 hour, as you can see here, like 1 hour training session, perfect example of one patient which was included in our research study. And of course, as I mentioned, they use also heart monitors to monitor heart rate. Yes, so that was basically structure of our data collection, that the heart rate monitor was connected to phone application. From phone through internet, all data were sent to cloud, and then we as a health professionals, we received the data on our computers, and we could follow data of our participants from anywhere. And of course, our participants also could do physical activities anywhere, anytime, any place. So basically, it was free living exercise programs that they didn't need to be attending particular days, particular times. So as I mentioned, yes, participants were required to collect glucose level measurements on a day so they did training, and yeah, 3 times in the morning before training, at the evening, because it's of course important to see what happens to your glucose level after training, because usually it goes up in few hours after training, and especially for those who are doing activities late evening, it's very important to keep in mind to measure their glucose level, not to get hyperglycemia while they are asleep. And body mass index was very high. They had obesity, and hip waist ratio also was high for both genders. So as you see, glucose level, fasting glucose level were quite high before, and also relative VO2 peak, actually not to VO2 max, but it actually was a VO2 peak, which was at a fair level for females and for males. So our hope was that we can improve this fitness level towards good. So unfortunately, our hypothesis partially was approved because of discipline of our participants. And that's what I mentioned, that behavior change is very challenging for those participants who hasn't been changing their daily lifestyle for ages. This is like our ideal training calendar for participants, what we wanted to see for all participants, that they are doing physical activities at least 3 times per week, measuring glucose level, and we have also time when they did physical activities. So we see these are like 1 hour physical activity training sessions, and these are times when they were measuring glucose level. So excellent calendar. But what happened in reality? So you see here that some people were just doing physical activity at the beginning, and something happened, and we don't know what exactly happened. They didn't tell us, but we saw that there are no data coming. So maybe there was some pain in muscle, maybe some life change in the situation. And we were trying to reach them and ask what is like reason why they stopped training. And sometimes there was like, I'm too tired. I'm getting bored. I have no time, and there were different explanations. So we kind of were really struggling with behavior changing challenges, that people were not aware that how important it is to push themselves and to do those physical activities on a regular basis in order to help their health. And some people were just doing it when we call them, and that at the end of studies they suddenly, oh, I have to show that I'm doing something. So they started to do actively physical activities at the end of study. They were not regular physical activities, and sometimes there was like some break in the middle, maybe some health issue, and then again resuming. But if there is such an interruption, of course, we don't count those physical activities for intervention. So we had to actually limit our intervention group because of those situations when interval training was done on a regular basis. And yes, there were some challenges also with the heart rate, and we saw that people were walking too fast, or they were walking okay, and then something happened and they just kept walking very slowly, or they were walking very slow, not according to the indicated time intensity. So yeah, of course, technologies are very helpful, but at the same time, of course, they still require regular communication with participants. So what were outcomes of our study? Behavior change didn't succeed. So many participants had not appropriate and kind of not aware about how much it takes from them to change this behavior. Significant outcomes were regarding a VO2 peak, a little bit, as you see, for control group, and for experimental group, intervention group, also VO2 peak increased. So that means that also control group, even they were following guidelines of endocrinology doctors to be more active. So they actually improved also their VO2 peak after 4 months. And what we succeeded to lower albuminuria transform, and for intervention group, it decreased more significantly than for control group, which actually in control group it stayed the same. And so glucose levels also decreased a little bit for intervention group, while for control group it a little bit increased actually. And cholesterol, there are no significant changes. So yeah, our outcomes were not as good as we expected, but of course it was first try, and we were happy to kind of know what we should do next time, and how, and probably next time we have to involve psychology professional who can also help us with changing behavior and consulting on how to change behavior for people with type 2 diabetes. Okay, so I think I have to stop here since our time is already 11:30. Kwok, if you can help me, and do we have time for questions, or if we need a short break between 2 sessions?
I think we started a little bit late, so I think we can start mine a little bit later, if that's okay with everybody else. So happy to.
Yeah.
questions if people want to ask them, and maybe we have a 10-minute break after that. There's a question from someone. I'm afraid I cannot read people's names, but there's thank you for
Olga.
interesting.
Yeah, it's Olga. Yes.
Okay.
Yeah, I see question. Yes.
Okay, so you'd like to take it?
Yes, I see the question. So question basically is, you talk about fasting glycemic control. What is the most reliable, popular, objective method for monitoring blood glucose? So what I know from my colleagues working together with endocrinology doctors, so they use this oral glucose tolerance measure. And usually it's what they do in a laboratory setting when patients are visiting doctors. So that's what they use. And if fasting, glucose measure. Well, early mornings they arrive to doctor appointment, and then they are given this drink, which they use to monitor glucose level. Are there any basic requirements for heart rate during exercise in order to achieve a therapeutic effect? Yes, I would say yes. So especially if we want to train cardiovascular system, we have to adjust intensity according VO2 peak. That was that's why I mentioned that VO2 peak sometimes is challenging to measure for those people who have very sedentary lifestyle, because like even on a veloergometer or on a treadmill, it's difficult for them to be aware about the kind of exhausting level, and sometimes they're already quitting exercise test, even they are not enough exhausted yet. And according research, in order to improve cardiovascular health, the high intensity rate should be up to 75 up to 90% of maximum VO2 peak, or sometimes they use also heart rate reserve. So in different publications, which I also have indicated in my slides, they use different kind of criteria: heart rate reserve, VO2 peak, or maximum heart rate. And sometimes they use formula to calculate maximum heart rate from 6 minutes walking test. Yeah, thank you. So different from type 2, but for which type will the treatment be more effective? Which type of exercise will be easier to tolerate? Good question. Again, we have to keep in mind those individual uniqueness of each person. But taking into account that type 1 diabetes is diagnosed early in age, like in the childhood or in an early age of life. So the person is more like adjusting his lifestyle, and he is more aware about what to do, while type 2 diabetes is mostly consequence of unhealthy lifestyle, while type 1 diabetes might not be related to healthy lifestyles. That's why, again, like this psychological issue, motivation of a person with type 1 diabetes in many cases will be higher to help to keep active lifestyle comparing to person who has type 2 diabetes, who has not used to have daily physical activities, and they have to be aware about changing physical activity modes. And then we have to know whether person is ready to start physical activities now, or they are still like in a expectation that they will do some time in the future, or they actually not thinking about those activities at all. So there we have to understand psychology of person, whether he is intended to start changing lifestyle now or later, or actually never. And then we have to discuss about consequences, what will happen in 5 years, in 10 years to you, to your health, if you not do physical activities. So that's why I think it's more challenging, of course, to apply physical activity programs for people with type 2 diabetes. Yes, there is a lot of questions. I'm not sure if I have time to answer all of them. Like sometimes people find any reason not to exercise. Do you use strategies to motivate them? Yeah, good question. And there is no golden standard. Like there are different strategies. We didn't have time to talk about behavior change strategies, but I think in next seminars by my colleagues in rehab projects, definitely we will have a seminar particularly about behavior change strategies. And there are, for example, theory of planned behavior and health approach directed behavior change. And here, yeah, again, there are different, for example, for people, it's very important to use social incentives so that they see other people doing physical activities and contributing from physical activities. And then it makes more sense for them to see how they can be involved. And that's why I mentioned that these group activities sometimes are more beneficial than individual activities. So social incentives are important as well. Yeah, can everyday physical activity have effects on diabetic angiopathy? I think every physical activity can be beneficial. So American Silver and Fit program, I'm not sure I'm familiar with that, but TANAPA, actually TANAPA it was a project. So I have links in my slides about this project, and those physical activity cards and video examples are products of a European project, what we did with many countries. So, and there is no really evidence behind the TANAPA project. So that's maybe what we should do in the future and see how those activity cards might be implemented in the research, and then we can compare with outcomes of other programs from other countries. Did you know about monitoring blood glucose level during exercise? Yes. If you do it in controlled environment, in a lab setting, of course, but also a person feels how he is doing those physical activities, what is his health condition during physical activity. And there is also certain recipes, how much, for example, calorie consumption should be done before what kind of exercise, like long-term exercise, intensive exercise. But again, we have to keep in mind that each person is unique, that sometimes those additional calories are not needed at all. But yeah, like glucose monitor, and of course, next research, hopefully it will get granted. We have applied another research with colleagues from Israel and Estonia. There is a continuous glucose monitors, which are, I don't know if they are used in Ukraine, but in Latvia, there will be first study now, which will use continuous glucose monitors. And they can be used for 1 week. And person is wearing this glucose monitor for 24/7. The same like actigraph, and he can check his glucose, and someone else who is connected to the application can check glucose monitor anytime. So yeah, that's answer is yes, you can control glucose all day and around with continuous glucose monitor. Okay, I think I finished here. Thank you so much.